Hey guys, this is Travis and Kyle with Beyond Bipolar blog. I don't know, maybe you should be down there. It's just gonna be annoying.
That should be a blooper, man.
Hey guys, this is Travis and Kyle with Beyond Bipolar blog. Today we are going to focus on acne. Now a lot of people, especially young kids or young adolescents, teenagers, when people go through puberty, many people experience acne. However, today I want to talk about how I used to get acne from a medication called Lithium, at least I believe so, but it never really started acting up until I was on this drug, and I was pretty certain that it was the drug because before that I never had an issue with it, and I didn't have to focus so much on maintaining cleanliness and taking a shower every day or washing my face every day. That alone was not enough, so I had to put myself on a prescription called clindamycin. It was clindamycin gel. It was actually prescribed by my psychiatrist at the time, and she suggested I use that. Now, back in the day when I had like bipolar depression, I had a tendency to not do anything when it came to self-care, so showering was kind of out of the option, and washing my face was out of the option. And sometimes when I was manic, I just didn't care about anything at the time. However, I started noticing a huge change with the way my face was looking later on in 2012, where I was on Lithium, and I had all these spots around my neck and on my face, and I didn't really like that. And no matter what I did, I took showers, I just used soap and water to wash my face on a daily basis, but that wasn't enough. So like I said, the psychiatrist prescribed me clindamycin gel, and that actually worked quite a bit. However, I think over a period of time, I felt like I didn't need it all, and I haven't been using it for maybe 7 years now. It just happened like a fluke in 2012 and 2015 where I had issues with acne. So today I want to discuss about that. I know in general, Kyle and I have both suffered from acne. I know there's some consciousness when it comes to acne and how people feel about themselves if they do have it. I know back in the day when I was in 7th grade and 8th grade, I was traumatized by it because my acne would be all over my face, and I didn't know that many people that had that bad of a case like Kyle and I. And to an extent, we did get on like some type of cream medication.
Which I'm glad we did.
That was through the refrigerator. It did have a tendency to dry out our skin, but it did take care of most of the acne. Sadly, Kyle kind of covered his face, and
with a hat.
He has actually divots in his face because those acne would cause scars in which they never really went away. But I don't know how else Kyle feels about it. I don't think he had any acne when it came to medication side effects, but I do know for certain he had acne. So I'll leave the reins to him to see what he has on his mind when it comes to acne.
Yeah, so to trail off on my brother's thought on acne, I think there's a lot of a psychological component. I think it actually really did kind of mess with my self-esteem and lowered my self-esteem, and I think it lowers a lot of other people's self-esteem, because like when you're pussing, and I mean you're just like a living meltar, and I don't like looking like that. And it's probably good that my mom was actually noticing that, because I think it's really important to mention that I think even though acne can just be just a cosmetic thing, I think it can be pretty important because it could cause permanent scarring when you get an adult. Because I know there's even adults right now that have scars, pretty bad scars on their face, because one, they probably didn't have money to afford the chemical compound to reduce the acne, but I do think it's actually really important to stay on top of that, let alone teeth, dental work, anything like that is important to be on there as well. But anyway, acne, I think back then really did affect me. It caused me to have some body dysmorphic issues, I would say, because it was really that bad. But anyway, I was really glad that my mom actually was assertive enough in actually having us get the cream. So now, going forward, I don't know if I really have any other bad acne.
You do have
things
some
like
right
my brother.
now.
I guess my brother says I had some right now.
I guess it doesn't.
They say it's caused by stress, but I wouldn't say I'm like terribly stressed, but like my brother says, it could be caused by certain medicine that you take, and I don't think the past meds that I did take affect my acne at all, to be honest. But do you know any other people that had any acne issues or Or what?
I can't think of any off my head. I just know that you and me really struggle with it. And like, to lead things off, guys, you know, I know it's just like a physical thing that's on your face or whatever, bumps or whatever, and it could definitely affect your self-esteem. And for those that have it and maybe struggling with it and don't know what to do about it, and maybe just don't have the energy to take a shower or get up to clean themselves, or you know, have enough care to actually want to take care of the issue at hand. But I strongly feel that I feel like I can be more appealing and a little bit more confident myself when I took care of the issue in 2012. 2015, it was really, really bothering me. So I'm glad I spoke up, and speak up to your psychiatrist as well. If you have issues with acne, there's a gel, like I said, called clindamycin gel. You just put that on after you wash your face, and it should clear things up. Now, if it gets really, really bad, yeah, maybe lithium had caused it, but at the same time, I have to admit that my hygiene was not that great, and to admit that I had struggled with bipolar depression, I was prone to not want to take care of myself at all, especially when it came to showering. I would only do it maybe once a week or even less than that, to the point where I would just have the inability to take care of myself, where I would just use the sink as a shower and just bathe myself that way. And largely spoken that way, I know how it feels to be depressed and just not sure what to do with your life, and you just don't want to take care of yourself. You just let everything go. But
maybe you can explain a little bit about the worst time of your life where you actually didn't take care of yourself. You wouldn't take baths at all until 2014.
Yeah, I was incredibly ashamed of living in my parents' house, and
we have actually old videos about it with our Beyond Bipolar blog, that we've been be able to be more stable and more functional as adults now. I mean, we've been pretty much living more as a normal adult can. Maybe you could explain a little bit about what it was, like some of the videos that we actually posted way back then.
I was on Lithium and stuff like that, and I guess it wasn't enough because I was experiencing psychosis, and basically I'd call it the poverty of mind, which basically is feeling like you're so poor you can't afford anything, you don't deserve to use anything that you don't pay for, and I had no money at the time, or I felt I didn't, and that means a whole lot more than actually being broke, which in reality I wasn't. I was still getting disability, but at the time I would use kitty litter to
go to the bathroom
in. I would poke holes with a knife
in the can.
I would in a vegetable can, and that's how I would eat. I would sleep in the basement 24/7
on that couch.
On the couch, I would eat from just whatever I had on the floor, and I would
clean your dishes in the
I would clean the I would clean the dishes in the bathroom. So it was pretty chaotic, and I grew my hair out because I was afraid to cut my hair. So a lot of things fell through when it came to taking care of myself, and I know how, if you're not on the right medication, or you're going through psychosis or some type of negative effects like schizophrenia, things like that, or whatever that's schizoaffective, that can really affect your self-care. So you want to get that addressed, maybe get on the right medications. I added Lithium to my list in 2014, and I suddenly started taking better care of myself after going to the hospital. And if it goes to that case where you're unable to take care of your needs or whatever, you know, if you're suicidal, get yourself to a hospital and get things situated as soon as possible.
So do you feel like there's a psychology component of saying that when you look good, you feel good on the inside, or does feel good on the inside has to come first before you look good on the outside?
You know, I think it's just a balance. You know, if you feel like you're not looking so great, maybe acne everywhere, or just basically not taking care of yourself, like you let your teeth go, it can definitely put a negative trigger to how you feel when it comes to self-confidence. But internally, I do believe that it's important to love yourself regardless how you look. And it's more important how you feel, but at the same time, it doesn't hurt to, you know, just have self-care, take care of yourself. And if mentally you can take care of yourself, you can take care of yourself well physically and spiritually, and having a balance is the key to maintaining success with your life and managing your mental health.
Since this is about looks and outer confidence, can we explain about our mouth and the teeth, or is that a different topic some other day, or just talk about that now?
I guess we can,
because maybe this topic can just be body dysmorphic or body issues.
if you want it.
Yeah, body insecurities.
If you want.
So I guess we're gonna continue it off because this is kind of a short topic. Anyway, there's also brands like Neutrogena. I don't, on the top of my head, we used to use is like this blue thing that would kind of burn and pop the pimple. Also, I wanted to mention, they say you're never supposed to pop pimples because it could just cause infections. I don't know. A lot of people do it. Even sometimes I do it. Even my brother does it. But
no, the thick ones you can't. But
them.
like if there's zits, I usually pop them. But they're kind of really small, even though that they can cause.
They also have this kind of pimple popping thing. There's actually a YouTube thing, probably Tinder or not Tinder, but what's that popular social media thing that people use, TikTok, where they pimple pop and stuff, and there's like some psychological component where people like seeing all that gush and stuff come out, which those whiteheads and blackheads is kind of interesting. But anyway, we want to lead off to our mouse as well. Our mouse was always our insecurity. We had bimascular protrusion, and according to my brother, maybe you can explain a little bit about
so bimaxillary protrusion is where the upper teeth and the lower teeth extend more so than, I mean, the average human being facial construction.
Yeah. Why did you get insecure about? Because you're bullied because having a mouth?
Yeah, people used to call me Kermit, and they call Kyle Brass Monkey or something like that, and we became very conscious of it because
they felt we looked like monkeys because of our teeth. So anyway, I think we were so like depressed and didn't really care about ourselves and like just angsty teenagers that even though our mom kind of brought it up and kind of wanted us to take care of ourselves, I do kind of regret not getting braces as a kid. Apparently, braces are not always eligible. I mean, I went to my dentist just recently, and it's really important to take care of your teeth, you guys, because when your gums recede, there's no way to get it back, and your teeth will basically fall out and rot. So even though dental work and the mouth work and mouth cleaning and cleaning your teeth is kind of a lower end tier, it can cause a bunch of problems if you don't take good care of it. So anyway, I went to the dentist. They have this I actually talked about whitening my teeth too at Smile Direct Club, which is the cheaper version. According to some people, to the dentist, some people are just born with yellow teeth, and now according to my mom, she claims that our teeth were yellow because my dad put us on a lot of antibiotics as a kid. Whether that's true or not, I don't know, but our teeth is pretty yellow. It's not as white as we wish it would be, and they're not as straight as we wish we could be. And according to my dentist, that not all, even back then, even if you get it before 18, not all health insurance consider it is not insurance worthy to use because it's considered cosmetic and it's really expensive. So unfortunately, a lot of people can't always afford it, which I can understand. It's too bad because I think the mouth can lead to better self-esteem. I know it talks about plastic surgery or anything like that, but I guess deep down if someone feels better about themselves, I guess so be it. But anyway, even if I got braces, maybe it could be in the future, but anyway, it'd be hard to straighten the mouth because they basically have to do a whole surgery on it. When
I honestly think they'd have to like cut the jaw and then push everything back. You don't even know if it's successful, even though I've seen videos or seen reports that people do it. I don't know if I'm comfortable doing it because there could be a lot of pain that might be involved, and it just seems really expensive in the end. So I've learned to accept it, but in the past I thought we had fetal alcohol syndrome because they have a very kind of a similar face, but
they have a wider jaw or something.
There's just something different.
Their mouth sticks out. The face structure goes like this, like at an angle. Or some Asians have really flat faces, but it's common in Asians and black people, right? Sometimes white people.
I mean, the bimaxillary protrusion.
Yeah.
Yeah, I mean, it's more.
So it's in the genes too, maybe.
It's possibly.
Or
I mean,
lack of nutrients we had before we were adopted.
Yeah. So what else do you think about it? Is there anything else you want to add?
Well, anyway, I do take these whitening. I did used to have this whitening cream that I put on, and now I actually just use this kind of laser type thing that my girlfriend used. I just use hers. And they also have these little teeth things, the teeth implants, where you just put on top. What's that called again?
Invisalign?
Oh, no, not. Well, Invisalign is one of the brands, but they also have these where you could put teeth caps on top. And they actually suggested that
veneers.
Veneers. which a lot of people
I
have.
don't know what it is. It's just veneers and you don't.
But veneers is an option. It's really fucking expensive. You really want a flat white teeth. But anyway, like the really only way to get like perfect white teeth is get veneers. But anyway, it's kind of fake, so I don't know if I really want that anyway. But anyway, I just want to let people know, take care of your health, especially, I mean, it's your face. It's okay to have a little self-pride in how you look. If you let it go, you'll end up looking worse, and you'll probably end up feeling worse. So it's important to, and we're all about health, so that includes physical health and taking good care of yourself and hygiene. So anyway, I wanted to mention that when your teeth recede and your gums recede, it won't grow back, so you have to be really careful and make sure to floss and brush 2 to 3 times a day as often as you can. Granted, we don't always do that, but it still is really important to keep up with that. So I guess another body dysmorphic thing I had is actually but when I got into puberty, one thing that was growing pubic hair that I was really embarrassed that when you come in that you would make fun of me, so I shaved it before you could come in. So, and also
that reminds me, because I really don't give a crap about waxing, but Kyle's girlfriend got him into waxing various parts.
It hurts, guys.
I mean,
especially down in the pubic area.
Does it make you feel better or no?
I guess I feel cleaner. I mean,
you can do without it,
but it's okay. I mean, you don't have to shave all the time, but I know some women actually do it all the time. We actually use wax and you just pull it off. Like if you've seen The Office or the 40-year-old virgin where he has all this hair and he's screaming because it really does hurt.
Oh, Kelly Clarkson.
Yep. And it hurts. Anyway, I used to be pretty embarrassed about pubic hair, but then I just didn't care. But it's okay to grow pubic hair. I mean, some people prefer not to be fully shaved, because I had like girlfriend in the past saying that she doesn't like being fully shaved. She felt like prepubescent, I guess, but it's up to personal choice. But anyway, I also was insecure about my chest back then, which now I like because I think it's a bodybuilding chest, but I actually would not eat. I would kind of starve myself and not eat during the day, which wasn't good, even though I was depressed in school. So
I think your posture was horrible. You'd always
but my posture was horrible. I was really depressed, but my chest is like stuck out, and honestly, it's just a bone structure. When I got older, my mouth, I noticed, got more extended. My chest became out, and it made me pretty insecure as a kid. But now that I get older, I actually like my bigger form, because some people are just naturally bodybuilders type bodies, and that's what my brother and I, because we were able to build muscle, and even though we don't have the fastest metabolism, we're able to build muscle. So is there any other insecurities you want to talk about? Maybe our height, about being short?
Yeah, I guess height is kind of sucks, but I mean,
we're pretty short, you guys. We're 5'2".
I'm 5'4".
I mean,
5'3".
I remember our family in Korea said they felt bad because maybe we weren't have enough nutrients because we were pretty short.
Possible.
But I think most women prefer taller dudes, especially if they're like taller. I don't think.
But you're well and down in other areas, according to your girlfriend.
Yeah, so that's all that matters. If you got the big D, that's all that matters. It's okay about your height. As long as you got the big D, it doesn't matter if you have a lot of hair.
Is that how we won Kim Kardashian?
Yeah. But anyway, those are our body dysmorphia that we had. Insecurities was our pimples, our face, our chest, our pubic hair in the past. But I think, I don't know, we always had that. We always had
comfortable in my skin.
Now we just don't care.
Just more.
I mean, we wear thongs and shit. We don't care. We just do whatever. I think deep down, my advice is, it doesn't matter if you're fat. Doesn't matter if you have a mouth sticking out. It doesn't matter if you're ugly or whatnot. It's a matter how you feel inside and how you feel about yourself. And you shouldn't let anyone or anybody dictate of you thinking that you should be lower than yourself, because deep down, the greatest enemy isn't other people. It's actually yourself. So it's important to have some confidence in yourself. Like Bennett's agreeing with me right now. He's very confident. He's very small, but it doesn't stop him from meeting other dogs. He thinks he's the big boy. But that's what you gotta be. You just have to have a big pride in yourself, and I mean, don't overextend it. Like don't think you're the best SHIT in the world, but it's still important to have confidence regardless wherever you go. Doesn't matter if you have a lot of money or not. That I truly believe that the biggest regret is when you of the death and the dining were these several things. One, working too hard, which I think some can't help. because they couldn't see their family as much, and 2, worrying about what other people think. So don't worry about as much what other people think.
I think one of the biggest problems is that some people can get really, really obsessed about how they look,
anorexia and self
dictates a whole bunch of mental health issues.
Like
and
self.
you got to be aware of that. There might be
Harm.
I might say people you should clean daily, but maybe there's people that clean 4, 5, 6 times a day, and that could be pretty obsessive compulsive. So balance is key, guys.
Maybe we should just take off our shirt now, just to show that we're proud.
Guess so.
I know this is up.
Say
this is probably not a good angle, but it's okay. So, as you know, we always take off our freaking shirt. People don't understand why. The reality is, 4 years ago, we were really fat, and we still wore thongs and stripped off our clothes anyway. And some people think, what the hell is the matter with us? But I just think it's important to be confident. So, it doesn't matter if we have 6-pack abs now, and muscles now, it just doesn't matter. I truly believe confidence is the key, you guys. Even if you're depressed, I know it's really hard.
And work on yourself if you want.
If there's something you don't like about it, if there's something you don't like about it, try to work on it, maybe. So
I ain't against plastic surgery, but don't overdo it. I mean, if it makes you happier, then I guess it's not something that
my girlfriend's looking at me because she wants plastic surgery in her calves. I said, that's kind of stupid. She got mad. Her calves. She wants lipo on her calves for some reason. I don't know why, but I think that's a psychological thing that her and I will have to discuss. But anyone has insecurities, and it's okay. That's why I try to be respectful and patient with my girlfriends. Deep down, it's her thing. But in the end, like I tell everyone and her, it doesn't matter what I think, it doesn't matter what my friends think, it doesn't matter what my family thinks, it doesn't matter what the world thinks or society thinks, as long as you feel good and strong on the inside, whether you're fat, ugly, poor, rich, or wealthy or successful, it doesn't matter, you guys. Just be positive. And this is like our positive message. We want to inspire you guys. Is there anything you also want to say about the struggles that we have and how you gain your confidence being just a human?
I feel like just guys, don't be hard on yourself, be kind to yourself.
Ladies too.
Especially females. I mean, yeah, we're not beauticians, we're not cosmetologists, but we do try to take care of ourselves.
Because we have time.
Yeah, a lot of people don't.
I know a lot of people don't. They work full time like my girlfriend, so you gotta be realistic. I think it's okay working like maybe 15 to 30 minutes every day, which is fine. I mean, you can even just do these Beachbody products from home for the most part, but Travis and I usually work out an hour to 2 hours a day, and he already did a lot of videos on dieting, so it's about dieting as well. So anything's possible. Try to be confident, even if you feel insecure. Try to have that strong core value of who you are on the inside, and try not to worry about and stay out of your head. Is there anything else you want to add before we end?
That's it.
All right, you have a good one, guys. Bye.
Please like, comment, and subscribe, and hit the bell button for future videos. Thanks. Bye.